Hello everyone. Welcome to Lify Life. What is skin xerosis and how to deal with it? If your skin suddenly began to suffer from dryness and itching, you have a good reason to consult a dermatologist. Has your skin started to itch and flake intensely? Do you feel tight and dry even after using moisturizers? In this case, we can talk about the development of xerosis. About what it is, why it is formed and what it is able to signal, the cosmetologist tells. Symptoms and stages of development of xerosis. Xerosis is a dermatological anomaly in which the skin suffers from excessive dryness and tightness. The cause of this condition is hyposecretion of the sebaceous glands. The production of sebaceous secretion, sebum, is significantly reduced. As a result, the hydrolipidic barrier is disturbed or completely destroyed and the protective function of the skin is weakened. It becomes vulnerable and more permeable than before. This allows harmful bacteria, toxins and viruses to penetrate into its deeper layers. It also stops retaining moisture in the dermis, which is why the epidermis, the stratum corneum of the skin, suffers, which receives most of the moisture from it. That is, the process of transporting moisture from the dermis to the epidermis is disrupted. For understanding, the dermis contains about 60 to 70% water. Symptomatically, xerosis manifests itself. Dryness and roughness of the stratum corneum. Peeling of the skin, flocculation. Increased sensitivity, irritability. Increased itching. The appearance of a network of wrinkles. The formation of micro cracks, skin loses elasticity. The presence of red spots. Lack of skin pores, almost invisible visually. Xerosis develops in stages. First, there is an episodic or slight feeling of tightness and dryness, which indicates a violation of the protective function of the skin. The second stage is characterized by hyperkeratosis, skin thickening, and active exfoliation of dead cells. Dryness and tightness are constantly present, and itching also appears. Often the skin becomes very sensitive, painfully reacts to the sun, wind, cosmetics, water. At the third stage, the formation of a network of deep wrinkles and microcracks is observed. The scales continue to peel off, the skin thickens, and the itching becomes obsessive. In addition, diffuse erythema, redness of the epidermis, and an allergic reaction may appear even to the usual care products. In the fourth stage, the skin atrophies. It loses volume, thickens, trophic ulcers can form. Reasons for the development of xerosis. What leads to the development of xerosis? In fact, there are many reasons, but I highlight the following. Imbalance of lipid biosynthesis, causing loss of transepidermal moisture. Deficiency of amino acids or vitamin A. Hormonal imbalance, decrease in the level of steroid hormones, estrogens and androgens. The use of aggressive cosmetics. Improper or irregular skin care. Disruption of the immune system. Frequent exfoliation, with harsh abrasives. Circulatory disorders. Unbalanced diet, lack of natural lipids. The influence of ultraviolet rays. Genetic predisposition. Also, xerosis can be a harbinger of the development of ichthyosis, psoriasis, atopic dermatitis, follicular keratosis, seborrheic dermatitis. In addition, it is often a concomitant symptom of diabetes mellitus, thyroid disorders, vitamin deficiency. How to care for skin with xerosis. Therapeutic therapy for xerosis has a systemic complex character. Therefore, the most important thing is to establish the cause that provoked the development of the disease. This will allow the doctor to choose the most effective drugs and cosmeceuticals for external use. It also makes sense to adjust the diet. It is necessary to exclude spicy dishes, fatty, fried, salty foods, sweets, alcoholic and carbonated drinks from it. As for the care products, they should be aimed at the renewal and strengthening of the hydrolipid mantle, the restoration of water balance, and the transport of moisture from the dermis to the epidermis. To this end, I recommend that my patients use cosmetics that contain urea, squalene, hyaluronic, lactic, citric acid, ceramides, phospholipids, vitamin A, E, C, F, provitamin B5, amino acids, lysine, valine, serine, glycerin, chitosan, soluble collagen, chamomile extract, aloe vera, calendula, lemon balm, lavender, natural oils. Separately, I want to note that with xerosis, the skin must be as delicately cleansed, toned, moisturized and softened as possible. Therefore, alcohols, benzyl alcohol, amyl cinnamyl alcohol, petroleum products, petrolatum, mineral oil, paraffin oil, sulfates, SLS, SLS, parabens, everything that ends in parabens, synthetic fragrances and fragrances, aroma, parfum. These ingredients can provoke an allergic reaction or cause severe skin irritation. Products for external use should be hypoallergenic, have a high safety profile, and also meet the age and individual needs of the skin. In addition, with xerosis, it is necessary to reduce the time in the sun as much as possible, since UV rays keep the skin dry. Xerosis of the skin can be hereditary, senile and acquired. Hereditary, constitutional, makes itself felt most often in adolescence. Senile is formed in the process of natural skin changes. Acquired can appear at any age under the influence of exogenous, environmental factors, the use of low-quality cosmetics, or endogenous factors, hormonal imbalance, genetic predisposition, etc. If you turn to a specialist for help when the first symptoms of xerosis appear, you can avoid skin atrophy. Separately, I want to note that xerosis is not a defect, but a problem that significantly worsens the quality of human life. Constant itching, redness, microcracks cause a lot of discomfort, often signaling the development of skin dermatosis. Therefore, if your skin suddenly began to suffer from dryness and itching, you have a good reason to consult a dermatologist. Love yourself and your skin. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.